A mother stares at her phone, tears streaming down her face. Her daughter's leukemia treatment costs $478,000. Insurance denied the claim. Then she sees the Federal Trade Commission report. The very drug her daughter needs was marked up 5,232% by UnitedHealth Group. While families sell homes and drain retirement accounts to afford cancer treatments, UnitedHealth reported revenues of $400.3 billion last year. Their pharmacy division marked up cancer medications by thousands of percent, generating $7.3 billion in excess revenue. From TacoCast Studios, this is Delay, Deny, Depose. I'm Johnny Lama. Today we examine how America's largest healthcare company turned cancer patients' desperation into a profit machine. Before we begin, I must inform you that major platforms including Spotify, Apple, and YouTube have shadow banned this show, and I'm not alone. Other truth-seeking shows face similar censorship. Consider this. What you're about to hear in this episode is shocking. With numbers so staggering, they seem almost beyond belief. Yet perhaps even more alarming is that these statistics have been publicly available for nearly a year. There's no question this information is being systematically suppressed. A stark observation that I'm certain Luigi Mangione had also made. Please share this show through whatever channels you can. Let's begin. Jen Coffey was an EMT, saving lives for a living. Then she got cancer. I lost my health, home, car, and career, she recalls. I sold everything I owned because UnitedHealth would not authorize or pay for treatment. She's not alone. The FTC investigation revealed that UnitedHealth's pharmacy division, OptumRx, along with CVS Health's CVS Caremark and Cigna's Express Scripts, marked up cancer drugs by staggering amounts. Gleevec, a life-saving leukemia medication that costs $9,000 to produce, was priced at $478,000, a markup of 5,232%. While Costco offered the drug for $97, UnitedHealth's mail-order pharmacy charged $19,200. This wasn't an accident. It was by design. The concern is no longer about patient care. It is about simply maximizing profits through their pharmacy network. The numbers associated with pharmaceutical prices are another example of how insurance companies have generated such high profits. Whether it's prescription drugs or other life-saving care, there is a person behind every dollar. While there must be enough money in the pool to pay out claims, something is seriously wrong when numbers are this distorted, especially combined with stories such as these. Dr. Elizabeth Potter was in the middle of performing cancer reconstruction surgery when United Healthcare called. They insisted I stop the surgery to justify why my patient, who was currently under anesthesia, needed the procedure, she recalls. The representative didn't even know the patient had breast cancer. That information was with another department. Do you realize she's currently unconscious and has breast cancer? Potter asked. The representative's response? Actually, I don't. That information would be with another department. This is how the machine works. UnitedHealth controls both the insurance and the drug distribution, creating what legal experts call a modern-day Standard Oil. In South Dakota, where 17.7% of adults carry medical debt, a cancer patient prepared to sell his farm equipment to pay for treatment. His doctor found him sobbing in the parking lot. The pattern repeats with devastating regularity. A father receives a letter denying his son's wheelchair. A stage 4 lung cancer patient scan denied. A woman with a dislocated shoulder forced to prove it needed fixing. Tim Anderson's wife, Mary, died from ALS in 2022 after being denied coverage for breathing and communication devices. In her final days, she could only communicate by blinking at pictures. The business model for insurance is don't pay, Anderson said. When Mary could still talk, she said to me to keep fighting this. It needs to be exposed. Meanwhile, internal documents revealed UnitedHealth was pressuring doctors to see 4 patients per hour. Dr. Susan Baumgartel, who quit after 25 years, recalls, "We were not truly caring for patients anymore. We were just micromanaging their care to bring in money. It just felt so unconscionable." But for UnitedHealth, business is booming. Last quarter alone, they reported revenues of $100.8 billion. That's more than the entire GDP of Ecuador. Dana Penhaker found out she had small cell carcinoma, a rare type of lung cancer. "When you're going through everything, that's an awful lot," she said. "I knew that I would not be able to afford to fight this cancer, and I would have to decline treatment." Without treatment, Dana was given 8 to 11 months to live. Kate Weissman's parents had to drain their retirement savings, $95,000, for her cancer treatment after UnitedHealthcare denied coverage. She's cancer-free now, but her family's financial security is gone. In 2021, patient out-of-pocket costs reached $279 million, increasing 14 to 21% annually since 2017. Christopher McNaughton knows this system intimately. His ulcerative colitis treatment cost nearly $2 million annually. Behind closed doors, UnitedHealth executives calculated savings from denying his care while ignoring their own doctor's warning about health risks. "This is just unbelievable," one United official said about McNaughton's family fighting back. "They're just really pushing the envelope." As this investigation concludes, the numbers become people. A mother selling her home to afford her daughter's leukemia treatment, a doctor stepping away from cancer surgery to justify care, a college student fighting for his life. Real-life people are dying from real-life emergencies, all while insurance executives continue to pad their own bank accounts. The questions become urgent. How did we reach a point where doctors must defend cancer surgery while operating? Where a drug costing $9,000 is marked up to $478,000? Where the difference between life and death depends on whether your GoFundMe campaign goes viral? I'll leave you with this. In the time it took to listen to this episode, 38 Americans declared bankruptcy due to medical debt. 4 of them were cancer patients. And somewhere, a UnitedHealth executive is calculating next quarter's profits. We must stand up and fight this. Everyone listening right now knows someone, or worse, has someone in their own family, being denied treatment or forced into bankruptcy to pay for prescriptions marked up by thousands of %. My show has been shadow banned by major platforms, including Apple, Spotify, and YouTube. Help me expose those who are keeping us oppressed. Please share this show with your coworkers. Thank you, friends. Until next time, I'm Johnny Lama.